One of the surgeries that's probably been around the longest and still will be viewed a lot of times as a gold standard in approaching patients with weight issues is the gastric bypass. And that's just because the length of time it's been out and the kind of data that's behind that. With the gastric bypass, I think that when you look out, there's a lot of misinformation about it. The gastric bypass is a more technically demanding surgery to perform. But when you go to metabolic surgeons who have done a lot of these kind of surgeries, they are very used to doing them and their outcomes are very good. With the gastric bypass, what is done is that the stomach is made a lot smaller. It's about the size of my thumb. The old stomach actually stays there. It's not removed. We will tell people that this is actually a reversible operation if ever needs be. But that's how it gets its name, is that the old stomach, a majority of the stomach, is actually bypassed. But what we do is make a small stomach pouch. Down below, the small bowel is divided and there's a rerouting procedure. No small bowel is removed. The small bowel is not hooked up to the colon, but a portion of the small bowel is rerouted, but a majority of your small bowel is not rerouted. And during that rerouting, that small portion of stomach, or that small stomach, is actually hooked up to the small bowel. The old stomach keeps making the acid, bile is plugged in, and digestive juices meet. And so food goes down one pathway, digestive juices go down another pathway, they meet, and you actually have a majority of small bowel where you absorb all the nutrients and calories you need. That is another thing that people will talk about the gastric bypass as being a malabsorptive surgery. The reality is it's not. I will say that there is an issue with vitamin deficiencies that occur. And that is important of why we keep people on a multivitamin regimen after any of the bariatric surgeries. That usually includes one multivitamin in the morning and then kind of calcium and vitamin D throughout the day. But what I will say is you will not malabsorb calories. If somebody goes out and has a very high caloric drink, they will get all 600 to 800 calories of that drink even if you have a gastric bypass. If you eat a meal, you will still get all calories of that meal. And so it's very important to make sure that we're changing that relationship with food and that lifestyle, so we've changed the types of meals that are going in. With the gastric bypass, it's actually a very safe surgery to be performed. It's a surgery where the biggest risk is where we put the stomach and small bowel together, that may not hold together. Thank goodness the risk of that not holding together is on the order of 0.2 to 0.5%. That would be something where somebody would hear of a leak happening. The risk of blood clots or pulmonary embolus is on the order of 0.3%. For most patients with gastric bypass, they're staying in the hospital maybe 1 to 2 nights. They're going home and being able to take care of themselves just fine right when they go home. Back to work time is usually within a week to 2 weeks. And you're on the same kind of dietary progression over the course of regular food back to regular food over the course of 5 weeks. For the gastric bypass, what we see is good, robust data showing weight loss, where if somebody has about 100 pounds to lose with the bypass, we expect them to lose about 80 to 85 pounds. So it's around 80 to 85%. As time goes on, that may differ, where some patients have a little bit of weight regain. Where long-term, maybe the weight loss is 50 to 60 pounds for every 100 pounds lost. But this is the importance of continued follow-up after these surgeries, to make sure that you're plugged in with a structural support framework where you'll do well long-term, and that any issues with weight regain can be addressed in an early stage. Thank you very much.